afternoon. I'm Lisa Clute, Executive Officer of First District Health Unit. I'd like to welcome you to our press conference today. The reason we are doing this is because we have seen increased cases of the COVID-19 throughout our communities. Our phones are very, very busy with lots of questions, and the hospital also is busy. So we just wanted to take this opportunity to provide you a community update on how things are going in regards to COVID-19. With me today, I have Dr. Wigway, who is the District Health Officer and an infectious disease specialist for First District Health Unit. He works at Trinity. I have Lacey McNichols. She is our vaccination coordinator, the vaccine guru at First District Health Unit. Dr. Sather, Chief Medical Officer at Trinity Hospital, and Randy Schwann with Vice President of Trinity Hospital. So just to give you a snapshot as to where we are today, and the thing that we have this time around is we have comparative data from where we were at last year at this time. So what I'm going to do is to show you how each of the counties are sitting where they compared to where they were last year on this same date. So in Botno, this year they have 11 active cases at this point. Last year on this same day they had 4 active cases. Burke County has 3 active cases. Last year on this same date, they had no active cases. McHenry has 9 active cases today. Last year on this same date, they had 12 active cases. McLean County has 25 active cases to date. Last year on this same date, they had 46 cases. Renville today has 5 active cases. Last year on this same date, they had no active cases. Sheraton has no active cases today. Last year at the same time, they had 1 active case. Ward County, today, they have 207 active cases. Last year on this same date, you had 126 active cases in Ward County. Our testing is going up substantially. However, it is not where we were at last year at this time. So I can go through each of the county tests, but as a whole, and this shows a comparison, to date at First District, we have done 5,701 tests within the last 14 days. Last year, during that same 14-day period, we had done 7,184 tests. So you can see we have less tests, and we're seeing more cases out of those tests. So with that, speaking of testing, we are testing at First District Health Unit every morning, beginning at 8:30. We are doing both rapid and PCR tests. We ask and beg you to call for an appointment. The reason we do that is so that we can be best prepared for the number of tests that the community is needing on that day, so we have the appropriate staff, and so we don't have long lines and people congregating together while they're waiting for their tests. So please call for those appointments. I know that most physicians are asking that if you are ill and in doubt, test. So please call for an appointment to be tested. At First District, we're going to continue to mask because the Delta variant has seen some breakthrough cases through the vaccine. Over the summer, we've all been able to let down our guard a little bit, and what a treat that has been. But as we see the increased cases, we still need to continue to recommend mitigation. Because we're seeing the breakthrough cases with the Delta variant through the vaccine, because no vaccine is completely effective, you still can spread. So again, because we have a number of people vaccinated, they may still be carrying that Delta variant and not know it and passing it along to others. So it is the courteous thing to do. Due to the increased cases and the testing that we're seeing, we've increased the number of people manning our phones. We are back to a full call center at 1st District Health Unit, and we are answering as quickly as we can. If you are not able to get through, please try again, and we will continue to assess that and increase the people available to visit with you with your questions and appointments as necessary. We are very committed to providing you timely, accurate, factual information, and so we will continue to do that on a regular basis and as situations change within the community. We want and ask that you follow our website, fdhu.org, and we will keep up-to-date information on there. Like us on Facebook, follow us. We are posting information on there too. So with that, I am going to turn it over to Lacey McNichols, and she is going to address some of the frequently asked questions in regards to vaccine.
Like Lisa said, my name is Lacey McNichols. I'm a public health nurse. We've been doing COVID vaccines almost for a year now. We started in December with our own staff, so we've had quite a bit of experience with the COVID vaccine. First, just want to update you on where we are as vaccination rates goes. Through our 7 counties, 1st District Health Unit, people who's received at least 1 dose is 35,231. We've given a total of over 64,000 doses of COVID vaccine to date. Our rates within the 7 counties range from 44.2% to 51.8%. In Ward County, we're at 45.8%. As most of you already know, the FDA did approve the Pfizer vaccine to be fully approved. It's not an emergency use no more for 16 and older. It's still in that emergency phase for 12 through 15, but 16 and older, it's now fully FDA approved. So in reality, we have more data on vaccine safety than we do on the COVID virus itself. So the vaccine is safe, it's effective. It's what we all need to be doing is getting vaccinated for those that can. We continued to see a lot of people coming in for first doses, which is great. In our 1st District Health Unit offices last week, we gave 248 first doses. So if you haven't been vaccinated yet, you're not the last, so don't be embarrassed. Come in, get vaccinated. That's what we're seeing, and that's what we want to do is get people their first doses. When in talking to the public that come in for COVID vaccines, we get a lot of the similar questions, so I just kind of wanted to touch on those. Again, vaccine safety is a huge question we ask all the time. Is it safe? And again, we have more data on the safety than we do on what's going to happen with the COVID virus 6 months from now, years down the road. With the pandemic that's happening, they're saying you're either going to get the vaccine or you're going to get the virus. The safest thing to do is get the vaccine. A lot of questions, because the mRNA, it's out in the public, so people have a lot of questions about that type of vaccine. In reality, the mRNA spike proteins get released from your body in 2 to 3 weeks after vaccination. The COVID virus can stay in your body for months and months, and we don't even have data for years down the road. So what is that virus doing in your body? Again, the vaccine is out of your system in 2 to 3 weeks after your immune system receives that message. A lot of people are concerned about side effects, and really, in the beginning, we were seeing more side effects, and I don't know if it was the worry, but in my experience, people are not experiencing a whole lot of side effects from the vaccine. Sore arm is to be expected, but you can feel fatigue, you can feel headache, chills. But you got to remember, that's not as severe as the COVID symptoms itself. And I recommend just taking after the vaccine. I don't recommend taking anything before the vaccine, but take some Tylenol or ibuprofen to help you get through the day. If you do experience side effects from the vaccine, it won't last more than a day or two. Again, with the COVID, you could experience symptoms for months. We got some questions like, is the vaccine working? Because we're getting so many breakthrough cases. Well, the vaccine, we expect breakthrough cases because vaccines are not 100% effective. So even at its best, it's 90 to 95% effective. So that means 1 person out of 10 is going to get a breakthrough case. So we would expect that. You know, the majority of people were vaccinated months ago, so our immunity wanes over time. So we're getting more breakthrough cases over time. Again, something that we would expect. If you were vaccinated and developed COVID, you may be experiencing, you may test positive and experience mild symptoms, but our goal is to keep you out of the hospital and keep you alive. And that's what the vaccine is doing. So we may not prevent you from actually testing positive, but we're keeping you alive. What's happening is the vaccine is mutating when it goes from person to person. So people that aren't vaccinated and getting infected with the virus, they may not have any side effects from the virus or consequences, but that virus is getting stronger the more and more people it's being exposed to. And we have more of the virus in our community now, so we're being exposed to it more. So people that are vaccinated are being exposed to it more, so again, we're gonna expect breakthrough cases. And then, of course, the question is what does it matter if I get vaccinated? It only affects me. Like I said, every time a virus exposes itself to a person, it mutates. So you're developing a stronger virus that our vaccine has to work against. And don't forget our kids. We have kids 12 years and younger who cannot be vaccinated and who are in schools. And you are risking exposure to those kids who don't have a choice on vaccination. So we gotta protect those kids. And then there's also people with weaker immune systems where the vaccine doesn't always work as effectively because they're sick with cancer or on chemotherapy or have to take high-dose steroids. So we have to keep those people in mind, and how we do that is to vaccinate more people. There is another respiratory disease that's coming up, flu. You didn't hear a whole lot about a flu last year because we were masked. We practiced social distancing. So those things helped keep flu at bay too. And we did a lot of vaccination with flu. So I just keep in mind that the flu is a respiratory illness, and to mix this with COVID could be disaster. And we don't have and many people doing the masking and that as we did at this time last year. So we're expecting more flu cases. So make sure you get your annual flu shot. At First District Health Unit, we are gonna start our flu vaccines. Let me back up. Well, okay, we're gonna start our flu vaccines the Tuesday after Labor Day. And to schedule for a flu appointment is the same way you schedule for a COVID vaccine. So you just go to our website and it says click here to schedule an appointment. So you can schedule totally online for your appointment for your flu or COVID and come into our office and get either or vaccine or both at the same time. You can do that. Then in the media too, and the scientists have come out with booster doses needing for immunocompromised people. So we have vaccinated some of those, but it's for the extremely immunocompromised is who they're asking to be vaccinated. So anybody who has active cancer for tumors or cancers of the blood, so that would be active cancer, not if you were in remission. If you've received an organ transplant or are taking medicine to suppress the immune system, if you've had a stem cell transplant within the last 2 years, if you've had a moderate or severe primary immunodeficiency such as DiGeorge syndrome or Wiskott-Aldrich syndrome, advanced or untreated HIV, or active treatment with high-dose steroids. And typically that would be 20 milligrams or more, and that would be oral. So those are the people that we're trying to focus on right now to come in and get those additional shots. The booster doses for the general public will come in time. The ACIP met yesterday just to kind of discuss what they're going to need to see to recommend a booster. So at this time, we don't have a clear date or time of when boosters were coming. But if you don't fit into those categories, you're going to get taken care of. Just, sit back and let those doses go to the people that need them. And then booster doses, hopefully we know something coming up in the next couple of months. But we do expect booster doses. To who they need to go to, that's yet to be determined. But that's the information that the ACIP, who makes the recommendations on vaccines, will make that decision. So I'm just making sure. Okay, and that's what I had. Dr. Wigway?
Yes, go ahead.
Good afternoon. My name is Dr. Wigway. I'm the health officer for 1st District Health Unit and infectious disease specialist in Trinity Hospital. Thank you, Lisa, for organizing this informative event. We had something like this last year, and many people said that you helped them understand the gravity of the situation. Here we are again. I was hoping that we don't have to. It doesn't have to come to this anymore. I think most people have heard almost everything they need to hear about this virus. To be really honest, I was hoping that if you have any question, I can answer any question. If there's still anything that is in doubt, there is a lot of information out there, and I've talked to a lot of people. I talked to a lot of patients. I talked to a lot of friends or acquaintances that usually my response is, if you have any questions, if there's anything you don't understand, I can help try to correct it. If there's anything you've heard online, people have sent me clips of things that are floating online there. I don't have too much. I'm not online savvy. But I'll just mention a few things, and then, like I said, I'll leave it up to if anybody has any question, because I don't want to bore you with things that people already know. The unfortunate thing about this disease is this pandemic is one area of medicine where everybody is an expert or feels that they are an expert. For any other disease, for cancer, whatever it is, if you have a headache, you go to see a doctor and, you expect them to, run some tests, at least tell you what. But when it comes to COVID, everybody, people, tell me they can read and they know what is going on and they understand it until, they get sick and they come to the hospital and, they are struggling to breathe. And, many times people will say, I didn't know it was this is what to expect. I didn't know it was this bad. They say that it's good to, to learn from your mistake, but it's even best to learn from other people's mistake. I don't want people to get to a situation where they're struggling to breathe before they begin to realize that all the nonsense out there online is all what it is, all that nonsense. So the things I will touch on a little bit today is the variants, the Delta variants. That's the variant that is circulating now within our community and in most parts of the country. Is highly infectious, perhaps 2 times more infectious than the previous variants that we had in circulation. And it's estimated that you're about 29 times more likely to be infected if you're not vaccinated versus if you're vaccinated. So the vaccines do work. There are breakthrough cases. And those breakthrough cases, I'll tell you in my experience, almost since the pandemic started, I've treated people with COVID almost on a daily basis, perhaps maybe a few days here and there. So I've been through the gamut of it. It pains me as a human being and as a doctor to see people coming to the hospital struggling to breathe, going through this when, like I said this last year, and I will say it again, is a preventable catastrophe. Yes, we know enough about the virus to prevent the illness. We know about mitigation strategies, but unfortunately, there's a lot of misinformation out there that is, forcing people to lower their guard and expose themselves and, take unnecessary risks and risk, loss of life and, extensive lung damage and, heartache for their family, through this process. So this variant is, the Delta variant, which is what is circulating. We don't know whether there's a new variant that will come that would even be more transmissible. The thing with viruses, viruses mutate all the time. That's the nature. That's the way they survive. Some of the variants will end up being less virulent than others. Some would be more virulent than others. Some will be less transmissible, and some will be more transmissible. You have a problem when you have a variant that is more transmissible and more virulent. So which is what we have in this in the Delta variant. But there's a possibility that even a more dangerous variant can emerge. So the sooner we can control the spread of the virus, the better it is for us, rather than waiting to see what will happen next. There are breakthrough cases in people who have been vaccinated. If you're a betting man, I would say, I would bet on getting the vaccination rather than not get it. Even as an infectious disease specialist, I was a little bit skeptical about the vaccine, when the whole process was happening. And that was why I was eager to see the data when it was released. And, anybody, even in forum where, there were other doctors, infectious disease, I asked a lot of questions. I read up on it. I tried to educate myself before, because I wanted to make sure that I'm comfortable with it before I can get it and before I can go out and advocate it for other people. Nothing is 100% safe, and nothing is 100% protective, but it's all a combination of factors that, we have to use. There are people who are immunosuppressed, Lacey talked about it, who have been vaccinated and are still developing breakthrough infection. What pains me the most is these people are doing everything they can to protect themselves, but they are getting infection from other people who choose to be careless about it. Sometimes it's close family members who have gone out and gotten infected, thinking that, they may have mild illness, and then passing it on to these people who are developing breakthrough infections when they themselves have not really done anything to get themselves exposed. So we know that for every vaccine is not as effective in people who have weakened immune system or people who are advanced in age. They're always the first in line to get vaccinated, but they always end up being the victim. And it's because there are people who believe that they are superhumans who go and get the virus or the infection and now pass it on to these people who, basically have done everything they can to protect themselves. So it's, like I said, as a human being, it breaks my heart seeing these people. So breakthrough cases do happen. It's an unfortunate thing, but it is the same mistakes that leads to the infection on the unvaccinated is what leads to the breakthrough cases. If everybody is vaccinated, if the younger people who are more likely to mount more robust immune response to the vaccine get vaccinated and don't get the virus, we won't be seeing breakthrough cases in people who have weakened immune system or people who are in advanced age. We have not seen, I have not seen any breakthrough case in anybody that is younger than 60 years old that does not have, a whole host of other, health problems. So the vaccines work. It works even better in younger people. That's the more reason why younger people should get vaccinated and not say that this is a problem with, only people who have weakened immune system and people who are older. We do it for ourselves, we do it for our family, we do it for our community. I don't know whether there's, I think that's all I have to say. Thank you for this opportunity. I'll be around for any questions.
Hi, Dr. Jeffrey Sather, Trinity Health. In some ways, this feels like here we go again, but it's been a while since we've been in this room, but it's not here we go again for us at Trinity Health. We've been dealing with this whole crisis now for a year and a half. And the crisis of the day or week seems to change, but it's been going on for a year and a half for healthcare workers. Healthcare workers are exhausted. And unfortunately, we're losing healthcare workers at an unprecedented rate across the country. It's not just here. So I want to just go over a few things, some information that you might be interested in. And we're here today because we're now seeing a second peak. We're not quite a year. It's not quite a year ago that we had our first peak here, and we were really in crisis, and we're starting to see uptick again in the community, and prevalence is probably higher than it's ever been in our communities. And so we're starting to feel that. And so I want to go over some information and hopefully answer some questions and give you a perspective on all of this. First, we're seeing, a month ago, we were seeing, 3 to 5 patients in the hospital at any given time. It's kind of been that way over the last several months. Over the last couple of weeks, numbers are spiking. We're starting that upward tick. Today, we have, we're seeing now 22 to 25 patients hospitalized in our hospital. We've again dedicated an entire floor to COVID. We're seeing around 20 patients a day with COVID in our emergency department. So overall, we're seeing 1 in 5 patients have COVID in our hospital, whether that's in the ER or on the floors. To dedicate resources to one disease for 20% of the volume on a given day in our hospitalized setting is just unprecedented. And we're back there already. Over the past month, we've seen that number go up. We've seen pediatric patients admitted to our hospital, probably with the Delta variant, that we did not see in the last spike. That's also something different this time around. In the month of August, we treated 58 inpatients at Trinity Health for COVID, 3 deaths. Average age was only 58, down significantly from a year ago. And the other thing about that, a large percentage of patients now have no underlying diseases. So these are young, healthy people that are landing in our hospital, and that average age is 58. We've seen some very young come in. Depending on the day, the percent vaccinated waxes and wanes, 75% up to essentially 100% on some days. So our numbers here are actually a little lower of unvaccinated than across the country, but overwhelmingly it's the unvaccinated that are the sickest patients and requiring hospital care. The length of stay for these patients, I think, like we talked about in past press conferences, is longer than the average patient. These patients, on average, spend 7 to 8 days in the hospital, and so much longer than most patients. So we're in that uptick. What does that mean for us, and where does that leave us? What's the difference this time around for us? Some good and some bad. The good is we certainly have better supplies now than we had previously. PPE is not a crisis for us like it was a year and a half ago or a year ago. But staffing is the handicap. As I said, staffing is our challenge. And it's not only our challenge here at Trinity, it's a challenge in other hospitals around the state and around the region and around the country. And where does that leave us? It leaves us with loss of some choice. And I've done a lot of reflecting on this because some choices are convenience choices, other choices are big choices. I want to tell you my personal choice. I had a diagnosis last year during COVID that I had 3 treatment options for. Now, a diagnosis as a patient, which could be a life-ending diagnosis if not properly treated. One of my choices, which actually I was going to choose, was to go out of state to a large hospital to get a procedure that is not done here. I was denied that because of COVID. So I altered my choice and had wonderful care, world-class care by the team at Trinity Health, and thankful for that. But that's a choice, it's a big choice as a patient that I was denied. The choice of wearing the mask seems minimal. What other choices are people losing in healthcare? We get phone calls. In fact, over the weekend, a patient was accepted to our hospital from the middle of Minnesota. Not because they wanted to come here because of family reasons or some of the other reasons people want to go elsewhere for health care, because there was no hospital that had a bed with a cardiologist, which is what this patient needed, and they were in a hospital that didn't have that service. And guess what? They couldn't find a hospital in Minnesota or on the eastern side of North Dakota to take that patient. They ended up being flown here to Minot. Imagine your loved one having to be sent 200, 300, 400 miles from home to receive basic treatment that we consider is our right. It's really a privilege to have. It's a privilege. It's a privilege to have choice in your health care. We're losing some choices. We're getting phone calls here in Minot asking us to take patients from places in Wyoming, Montana, other parts of North Dakota, Minnesota, way outside of our normal area because they can't find an ICU bed or proper placement where the specialties needed for that patient are close to home, which are their normal referral patterns. Likewise, we have patients in our region that normally would come to Trinity that at times we don't have a space for. They'd end up having to go to Fargo or other places for their care. Not because that's what they need for their care, because that's the only place that might be available. And guess what? Sometimes patients are having to sit in some of those small hospitals and delay the care. As a patient, when you're told, here's your choices, but then when you pick and you're told, sorry, can't, that's a big choice. That's a big blow. I've pondered on this, and I see this, I've seen this many times, and so have my colleagues. We see patients, talk to the patients, and they're in for treatment, and they're sick with COVID. And they want treatment like monoclonal antibodies, a man-made substance. And you talk to them about, why weren't you vaccinated? Well, I don't want that. But now they're laying on the bed begging for the treatment because they're starting to get sick. Dr. Wigaway talked about no treatment's 100%, and it's not. If you have cancer and you get chemotherapy, you're taking poison in your body. It's a risk-benefit. And in discussion with your physician, the expert in that area, you make your choices in healthcare, and you choose the benefit over some of the risks. When it comes to things like vaccines, they're extremely safe. I hear, one of the excuses I heard in past is it's not FDA approved. Well, guess what? All of those supplements that people take, everything you go consume. Think of the things we consume in our body on a daily basis. We go to the grocery store and pick up a can of this or that. We heard about a supplement that does wondrous things. Those things are not regulated at all by the FDA. Yet we choose to consume them. That's our personal choice. So think about those choices. What's different in an infectious disease choice versus many other choices we make? Most choices we make affect us. Infectious disease affects all of us. So we're making our choice, but our choice affects our neighbors, our family members, and our friends, our fellow citizens. So I just want to put an appeal out there to talk about mitigation of the virus again, because we're starting to get inundated with patients at our hospital, and we're keeping up with difficulty. But patients are being transferred across the state and across state lines, finding that hospital that has the capability on any given day, and it changes hour by hour and day by day. And we need to, again, try and slow down the spread. Mitigations like wearing masks, decreasing your public gatherings, getting vaccinated are the only thing that we can do individually to affect everybody. So think about those things. And I know this is a huge political thing, and everybody's got to make up their mind, but I hope eventually people will look at real data and real information and start realizing what's important. I want to touch on monoclonal antibody treatment that is available. So if you are positive for COVID and sick, I would recommend you contact your primary care physician. I know through our health system, your primary care physician can order the monoclonal antibodies and get you set up to get that infusion. If you're extremely sick, present to the emergency department and be seen. If you don't have a primary care physician, you can contact our infectious disease department and they'll get you set up with monoclonal antibody treatment. Randy, I'll let you finish out our other topics, and thank you.
Thank you. Again, I'm Randy Schwann on the executive team at Trinity Health. What you're hearing today is some pretty powerful testimony. I'm going to add to a little bit to give you some guidance about how to access some of that. So we have a vaccination hotline. If you're interested in calling for a vaccination, first dose, second dose, and soon to be booster doses, you can do that through First District Health. Or at Trinity Health, our number is 857-2515, 857-2515. We are at Trinity Health now in a moderate visitor restriction category. We upgraded that from minimal a couple of weeks ago with the increasing spread and cases that are rising, as Dr. Sather pointed out. So moderate restriction level means that if you have a patient, you want to visit a Trinity hospital, they can have one patient visitor per day. So you and the family chooses who will be the visitor of that patient that day. That's if they're not a COVID positive patient. For COVID positive patients, the visitation is even tighter, more tightly restricted, and they'll be granted on a case-by-case basis. Masking is required to gain entrance or to stay within one of Trinity Health's facilities. That's an outpatient clinic, the hospital, the pharmacy, doesn't matter. Mask is required to gain entrance or to remain in the facility. If you are coming to an outpatient clinic visit, one asymptomatic adult can accompany the patient under the moderate restrictions. So last November, December, we increased it from moderate to maximum. And those restrictions get even tighter. So we're not in that condition yet. As these other presenters have said, though, we have some tools available to avoid that. And the only way out of this is vaccinate, vaccinate, vaccinate. I think that's all I have to offer that hasn't already been covered. So we'll stand for questions, I guess.
Just to wrap up a little bit, Lori is following our feedback feed, and there are some questions in regards to the Delta variant and testing. So the way that works is when you are tested with a PCR test, not with a rapid test, but with a PCR test, that is sent into the state lab. They can sequence any PCR test. At this time, all tests are coming back as the Delta variant. So they don't test every sample that is sent, but they are testing a large portion of them. And everything is coming back indicating as the Delta variant in our community right now. So I guess the one thing that we also encourage is if you have questions, these are important health questions, ask your doctor. We say that I don't know how many times at First District. Talk to your private physician who knows you, who knows your health status, and can serve as the best advisor to you. We will continue to provide information to you as information changes, and as always, please feel free to call. We are testing, as I said, and as soon as we're done with this meeting, we're going back and apparently addressing how we're going to increase capacity on testing. So there's a lot of people coming in right now for testing, and we ask that you please make appointments for both testing and the vaccination. It's a way for us to control the flow. It assures that you get in and out in a quick manner. And the testing involves couriers to the state lab. So that is an important factor when we are arranging for the testing, is getting that specimen to that test to the state lab by the end of day. We have been at this a long time, and people's nerves are frayed, they're tired. There's a lot going on and a lot of communications in regards to it. I would just plead with you to please be respectful of each other as everybody is making decisions with their doctors, with their family. Be kind to each other, but mostly just be respectful. We are talking about important information, a very highly contagious communicable disease. And everybody is going to take that information and do something different with it. We will continue to provide you the facts and the information from your local specialists. And as always, feel free to tune in. We'll continue to post information on Facebook and web pages and provide press conferences as warranted. So with that, are there any questions? We have time for a few here. Go ahead.
Is Trinity Health close to capacity in their COVID wing?
It's a Trinity Health question.
Is Trinity Health close to capacity for their COVID-19 wing?
So the question was, is Trinity Hospital close to capacity for inpatients on its COVID wing? And the answer is yes and no. So today we have gradually increased the capacity for COVID patients in our hospital like we had a year ago. We have an entire floor that's now dedicated to treatment of and care of COVID patients. If we needed to expand that, we'd go to another floor like we did last year and increase capacity for COVID patients. Last year's response to, I think we had up to 70 patients at one time or so. And so we're not there yet. So we can build in, and we're flexible enough for that moving patients around. But your question about capacities comes up not only with COVID patients, but just other patients, any patient. I looked on the website earlier this week, and the number of ICU beds available in North Dakota was limited. And so that's a function of how many staff do we have in ICUs that can put patients in their ICU beds, and where those bubbles occur, where those peaks occur. So in Minot, we might have a couple of ICU beds available today. We might have 6 available tonight. And tomorrow we might have 0. So the ebb and flow of how healthcare works and how patients get better or worse, we can't predict that. But we do have capacity today. And across North Dakota, I think there's about 22 beds I saw this morning of ICU beds. Now that might change as of now, but as we get deeper and deeper into this pandemic, where the positivity rate is increasing and the people that come in are getting sick and they don't avail themselves to vaccines, we can see a day where we're going to all be calling every morning with every hospital in the state like we were last year. Do you have a bed? And invariably last year, that number of ICU beds available at any one day was 1 or 2. And so we have, we see what's happening. We played it out already last year. There's no reason to believe it's going to be different this year, except for we have vaccine. We didn't have that last year. Now, whether we will see the advantage of that, it depends on how many people become protected. We know that it takes a month or 2 to be effectively vaccinated against COVID virus, right? You get your first shot on day 1, you get your second shot in 3 to 4 weeks from there, and from then it takes another 3 to 4 weeks for full immunity. for the full benefit of the vaccine. I look to my clinical staff here for some support. Is that correct?
2 weeks after the second.
2 weeks after the second shot. So that's 4 to 6 weeks after you first get a shot. So what you do today matters, not tomorrow, but it matters for next month. And what you put off today matters later on this winter.
Question for you, Randy.
Jane?
I've had conversations with at least one primary care physician who said that they would really like the ability to provide vaccines in office because they have conversations with their patients and are able to explain to them and get them to kind of move toward the vaccine. Is that something that Trinity is doing or plans to do?
Yes and yes. So Trinity is doing that now. We have some primary care clinics that do have the vaccine available to them for the patients that come see them. We are also offering the weekly call for a slot mass vaccinations. Every Friday we do that. Our occupational medicine office offers vaccine on a more regular basis. So we are again offering a Saturday clinic coming up. Look for that information so we can vaccinate up to 12 to 1,300 people like we did last year. So there's a variety of ways people can get vaccinated. One is through their primary care office. Call ahead. And if they don't have it, we'll try to get them an office where they can get it, or try to have that primary care provider to receive that vaccine in advance of that appointment. So call ahead. It's possible to get done at your primary care physician's office today. I don't think we have 100% coverage, but we're getting there.
Then one more question about the vaccines, the third shot for immunocompromised.
Yeah.
There is a question on whether or not that includes people who are on biologics.
I can't answer that, but perhaps Dr. Wigway, Lacey, want to talk about that?
Yes. So that would include people who are on biologics. They are considered immunosuppressed. There are different kinds of biologics, but without trying to separate it, I would categorize everybody that is on biologics as being immunosuppressed and eligible to get a booster shot. Or third dose vaccine.
Maybe add one tag on to your, we're looking into October. We don't have exact dates, but in October we expect we will have at Trinity mass booster dose or third dose clinic set up for the general public.
So a question for one of the doctors. I've heard from a lot of women in their childbearing years that they are nervous about getting the vaccine because it may affect fertility. Is there information coming out related to that?
So the question was, women in your childbearing years or pregnant, should you get the vaccine or not? And I think the best advice is talk to your private physician. I'm not aware of anything to the negative, Kashmir, are you? But the best advice is always talk to your physician because it's a personal health choice that you need to do. So.
Yes, women in childbearing age should. It's recommended that they get the vaccine, and there's been actual studies of the vaccine in pregnant women. So it is safe and effective without any significant adverse effect, both in pregnant women and women of childbearing age, and even in men of childbearing age. Believe it or not, I've gotten that question about, men saying that it would negatively affect their infertility. And some group, I think it's from New York, actually studied that, and they were surprised to find out that the sperm count went up after vaccination. So, and there is studies showing that in fact, rather than the vaccine being having a negative impact, that the virus itself, can have a negative impact on fertility. So I think the slogan that I saw yesterday was mask up to keep it up, or something to that effect. So, so that's a benefit.
Are is First District Health Unit still offering the Johnson & Johnson vaccine? Is Trinity Health still offering the Johnson & Johnson? I know that's kind of been, there's been a shortage of the
I'm going to let
J&J.
Lacey.
Yeah, so the Johnson & Johnson nationwide is hard to come by, and actually the state health department just received some from out of state that expires in September, at the end of September. So what they're doing is kind of pulling it from other states that aren't using it and using it. But once we get past that September date, they don't know when to expect to get more. So it's very in limited short supply. If you can see it, get it. But we can't control what we get. So we do have a limited supply at First District, and we just got it last Thursday. So we're having clinic Tuesday and Wednesday. So it's on a first come, first serve. And I know Trinity did get some too. But again, we got 50 doses. So it's not a substantial amount. And then once that's gone, they don't know when we'll ever get it again.
Clinic Wednesday and Thursday.
Oops. Clinic Wednesday and Thursday. I'm sorry. Did I say some? I'm sorry. Clinic is on Wednesday and Thursday this week.
All right, well, thank you for your attendance and your interest, and stay well and stay tuned for further information. Thank you.